The number of confirmed deaths rose by 18 from yesterday, now at 3,642. Total presumed recoveries over 174,000. Now this morning, 2 physicians in Dothan were the first in Alabama to get the vaccine in the state. Both rolled up their sleeves at Southeast Health. And today, UAB Hospital gearing up to give out the vaccine doses it received. The system received nearly 11,000 doses this morning. That's more than a fourth of Alabama's first share of the drug. UAB expects to start giving shots to hospital staff and medical workers on Thursday. They'll be available by appointment only at its medical center and UAB Highlands parking deck.
We anticipate when we gear up, we'll be able to deliver as many as 1,000 doses a day. So that is our goal, and hopefully all of our plans will go well and we'll be able to accomplish that.
But this is just the first of many vaccine shipments. Coming up at 6, State Health Officer Scott Harris shares when Moderna's COVID-19 vaccine could hit the state. Well, today, a critical care nurse received Coleman Regional's first COVID-19 vaccine. The facility was one of the first 3 in the state to get their allocation yesterday. Donna Snow has been a nurse for more than 40 years with certifications in cardiac medicine and acute critical care. Also today, East Alabama Medical Center in Opelika received its shipment of the Pfizer vaccine. They shared pictures on social media saying they'll start distributing shots to frontline employees today. In Alabama, reporting more than 2,300 COVID-related hospitalizations statewide. 161 of those were at UAB as of this morning. Well, the state's hospital system becoming more stressed by the day as the number of COVID-19 hospitalizations rise. WVTM 13's Chip Scarborough looks at what that means as we head into the Christmas and New Year.
I worry greatly that we're going to push hospitals over the edge in the coming days.
The number of COVID-19 hospitalizations in Alabama jumped from 2,000 last week to 2,300 this week.
I think if we thought 2,300 was the top, it would make life a lot easier.
But with 2,000 or more new cases being reported every day, Dr. Williamson expects statewide hospitalizations to keep climbing as well. He says a quarter of the patients in regular hospital beds right now have COVID-19, and then 40% of patients in ICU beds have the virus as well.
COVID is taking up a growing percentage of those hospital beds.
Dr. Williamson says while the vaccine certainly creates hope for the future, he worries it's causing people to let their guard down way too soon.
And as a result, they're going to have large gatherings at Christmas believing that we're back to normal, when in fact nothing could be further from the truth.
A vaccine won't be available for the general public until at least the spring. Williamson says that could make the Easter holiday a safer one, but not Christmas. He says we're heading into Christmas with less than 10% of ICU beds available statewide.
So if I'm seeing us at less than 10% ICU beds, I know the system is very stressed.
Hospitals now being forced to cancel even more elective and non-emergency surgeries to make room for more COVID patients. In Birmingham, Chip Scarborough, WVTM 13.